Well, I guess we'll go ahead and get started. I think if they're going to come, they're going to come. So anyway, I think most of you who were here yesterday know me. I'm Dr. Beverly Gore, and I'm the Summit Chair. I have the privilege of being that role today. By profession, I am actually a registered dietitian. My doctoral degree is in health education. I've had the privilege of working for the Houston Health Department for several years. I was a consultant for the Harris County Health Department too. Um, I'm a native Houstonian, and I always like to tell people, even though I am Chinese, hablo más español de chino. And so that's kind of a good thing, but also kind of a liability that I have. I have so many Chinese friends come up to me and talk to me in Chinese, and I go, I'm sorry, I don't speak Chinese, but I have people who speak Spanish. They're real surprised. They go, "Oh, she understood what I said." So anyway, it's kind of different being a native Houstonian and being Chinese. Um, Anyway, I was employed with the MD Anderson for 14 years. First, I started as a program coordinator, then I was a postdoctoral fellow, and then became an instructor at MD Anderson. That was a very good experience for me. I worked with a group called the Center for Research on Minority Health, where I really cut my teeth on research in minority communities, particularly with cancer and health disparities. So I had the privilege of doing several Asian American studies on the Chinese, Vietnamese, Filipino, and South Asian communities, which really helped me get to know a lot of people in various communities. So I am a co-founder of the Asian American Health Coalition and the Hope Clinic. And so I really appreciate being here and appreciate why you're here. So why we decided to have this session, it's to talk about what the AAPI community needs to know about crisis management, particularly in mental health issues. Um, I can say myself, I was saying earlier in a session, I'm an American-born Chinese. I speak English well, kind of like Pata was saying, but I've had my own issues with mental health. And when I mention it to my mother and father and even my husband, they go, "What's wrong with you?" So there's a lot of suppression, I think, of our mental health issues. Don't talk about it, it'll go away, just let it be. And so I feel like, I'm not I don't think I've had to have treatment. I mean, I have gone for therapy, I'll admit that, but I think it's something that's a real hush hush thing in our community that we need to unveil, that we need to talk about. As Pata was saying, we need to normalize a discussion about it. So that's why I wanted to have this panel. I have three people with me that I've really gotten to know, and they're very wonderful people. The first one, I just want to introduce her, is Sarwa Newman. She is an Iraqi American. She holds a languages bachelor's degree in German language from the University of Baghdad. She worked with U.S. Aid Iraq for over 9 years, working with U.S. Army, Marines, international organizations, the government, and local nonprofit organizations. Sarwa is now a certified community health worker and certified application counselor here at the Hope Clinic. Then I have Kimberly Lee. She's a licensed professional counselor and licensed chemical dependency counselor. She currently works as a project coordinator in behavioral health services at Memorial Hermann. She ensures that behavioral health patients receive the most appropriate and effective treatment when they are admitted to the hospital in a crisis. And beyond hospital coordination, she brings a wealth of experience as a private practice therapist. And then we have Johnny Lynn. He's a licensed marriage and family therapist and licensed professional counselor. He is a graduate of the U of H Clear Lake Family Therapy Program. And prior to working at Memorial Hermann, as part of the Behavioral Health Department, Johnny worked at Search Homeless Services and is partially involved with work involving the formerly homeless. Johnny also worked for the Family Enrichment Clinic, which was a multicultural clinic focused on serving the Asian and South Asian American population. So I'm going to start with Kim, and she will give us an overview of signs and symptoms or red flags of a person going through a mental health crisis. She also may tell you more about herself. So Kim, I'll let you start.
Hello. Okay, perfect. As the previous speakers had noted, some of these signs and symptoms we may see in people that we love or even ourselves, but may be ashamed to admit it. I can go down various topics, but I think one of the things she had mentioned earlier, the previous speaker, was her previous suicide attempt. So what are the signs and symptoms of someone who may attempt suicide or may be going through a mental health crisis? And what we can do as professionals or loved ones, and the questions we can ask to them to see how severe may be their mental health crisis and what we can do. Background, I work in a hospital system, so I'm familiar with hospitalizations as well as how mental health warrants work. I don't work for the court, but I can only tell you from my hospital experience what usually happens. So some things to look out for are the signs and symptoms of just someone who may be severely depressed. Key thing, if someone's ever mentioning that they want to die or has suicidal thoughts, um, if so, you hear someone say, sometimes I wish I would just like, I'm better off not being here on earth. That's, I think, a very common sentence that someone would say that a loved one might not be too concerned about because it's not like they're saying that they have some sort of plan as to how they would want to die. But that it could be a starting symptom as to worsening depression. Questions to ask. If someone ever said that, you have to really just be direct with them. Have you ever thought of ways of how you would want to die? If they say yes, okay, let's ask a little more. These are some questions that you probably do not want to ask them, but it can also assess how serious are they really thinking about death. If they say, you know, I could just take a bottle of my blood pressure meds and just end it. That is extremely concerning because one, they have thoughts of wanting to die, and they've even thought of a plan as to what they would do. So, okay, let's ask more questions. What reasons do you want to die? These are questions, of course, that as loved ones, we would be scared to ask. But these are questions that we need to ask so we know, okay, my loved one may need help. So, other signs to ask or things to look out for is one, do they look depressed? If they are a happy go lucky or just general happy individual, and then all of a sudden they look sad and withdrawn, they're not really talking to you, they're not really engaging in things they used to enjoy, those are more signs that this person might be depressed. If you've noticed changes in how they're sleeping or eating, such as if they're eating or sleeping more or less than usual, if they say things that they're worthless or they're hopeless, they just have like very low energy, they don't want to do anything. Those are all signs to look out for someone who might be having like a depressed episode. So, what do you do if your loved one says, you know what, I just want to end it. I just want to grab this knife and stab myself. You know what, I thought about hanging myself in the cloak closet with XYZ. Those are very severe. And these are things I've actually seen happen. People do these things. Or if they have access to actual firearms, that's something to look out for too. So if your loved one said any of these things to where you think, oh my gosh, they're going to try to kill themselves, what can I do? And if you talk to them and they're like, no, nothing's wrong with me. I don't need any help. I'll be fine, which is something that the AAPI community might say because mental health is not a thing. I don't need help. Or they might turn to religion. Don't worry, no, God got me. It's okay. I'll be fine. But you see them slipping, you see them getting worse. So, what are some things you can do? If they are refusing to get help and they're obviously in this mental health crisis to where they will probably do something soon to hurt themselves. One, and oftentimes you can call a police officer if you're concerned. Like, for example, if you see your loved one like about to grab a bottle of pills and about to like chug it because they want to kill themselves, you can call 911. This is obviously an emergency. There are some counties, I can't say some counties because not all counties have this, that might even have trained police officers who can work with mental health crises. And they're able to go out to wherever this person is and to help assess and de escalate this situation. I say that because not all counties have this. So in Harris County, we are fortunate that we do have like mental health deputies. So deputies that are trained to go out to these types of calls and to help these types of people. I say that because it's very important, because how many times have we heard on the news that like this schizophrenic person who's, acting crazy and causing a ruckus gets harmed because there's a police officer who doesn't know how to adequately help this individual. That's why there's some programs that have mental health clinicians and or mental health deputies trained to assess these type of situations to make sure that they are not harmed and that they can get the treatment that they need, and that they're brought to safe places such as a mental health hospital or a medical hospital, because hospitals are 24/7. Someone can be there to watch them and to help them and to assess further needs. So your loved one saying that they want to hurt themselves, what do you do? I'm going to call 911. And if I'm in a county where they have a mental health deputy, hey, I have a loved one who's trying to kill themselves. They have a bottle of pills. I try to fight them for it. I need help because this person is going to kill themselves. Please send help if you have a mental health deputy. Okay, so an officer will come and assess the situation. This is like a hit and miss depending on who comes. Obviously, the legal system is not going to, it may not go well the way you want it to. It just really depends on the situation and the officer, or if there's a mental health clinician with them. But they would come and assess the individual if they're able to. And they would also get information from the loved one who called 911. So if I were to call 911, I would tell the officer, my loved one just tried taking a bottle of pills. They're saying they want to die. They need help. Okay. So the officer, like what our keynote speaker said yesterday, can put the person on a mental health warrant and take them to a safe place, such as a mental health psychiatric hospital or a regular medical hospital, to where they're in a safe environment. If they get taken straight to a psychiatric hospital, they can get assessed, they can, get admitted and get help there. If they're taken to a regular hospital, they're in a safe place. And from there, what happens usually, I don't work for all hospitals, only work for one, but there may be a mental health clinician that works for them that may assess the individual to determine, is this patient in need of inpatient psychiatric care? When I say that, means like as they need to go to a psychiatric hospital, because we're a medical hospital and the majority of hospitals, especially in the Houston area, do not have a psychiatric unit. So they need to get moved to a psychiatric hospital if they are in need of mental health treatment in inpatient setting. So they can get assessed, and then if it's determined that they need to go to a psychiatric hospital, then they will go there. So if they're unwilling to go, the hospitals can file mental health warrants to get the patients there if they are a danger to self or others. Now, once they get to a psychiatric hospital, it's like the very similar thing. They can keep them there for X amount of time. And if they still need to stay there longer and the individual doesn't want to stay, they would have to continue to file mental health warrants, and the individual has to go to courts and have like a court liaison to determine that this patient needs help and ongoing treatment. And that's what they would do. So the story I gave you, or the example, is about someone who like wants to attempt suicide. What other crises are there? People who are having psychotic symptoms. People who are seeing things that aren't there, hearing things that aren't there, loved ones that are extremely agitated and aggressive, who may want to hurt you or other people, or run across the street because they are so mentally unstable that they can do behaviors that are unsafe that can cause harm to them or other people. The same kind of general process would apply if you were to try to get them help. So that's kind of like the gist of how hospitalizations work and mental health warrants. But if for some reason you do not come in a situation to where you need to call 911, but you know that this person needs help, you can actually go to your local your court and file a mental health community warrant, where you would have to provide like written evidence as to why this person needs to be committed to a psychiatric hospital. And from there, if you apply for a mental health warrant, a judge would read it. And if they approve, then what would happen is they will send a deputy to pick up the patient or the loved one with that community mental health warrant that got approved by the judge. Like they'll pick them up from their home and take them directly to a psychiatric hospital for help. Now, I've heard of, I feel like you have some questions, Hoda. So I've heard, so I have like a friend who has a sister who has mental health issues, who's constantly refusing help. And she lives in my friend lives in a different state. So I had to help look up like what's the local mental health authority in like the Dallas area. And unfortunately, where her sister lives, they don't have mental health deputies. But just like all counties, they at least have a mental health community warrant that you can file. So I kind of tried to told her, go to this website, you'd have to fill this out. There has been a time where her sister was being very erratic. They did call 911, but unfortunately, when the cops got there, they're like, oh, she's fine. And they're like, what do you mean she's fine? She's literally telling you she's hearing voices, telling her to do XYZ. And they're like, well, we talked to her. She says she's taking her meds. If she looks okay. And they left. Very unfortunate incident, but it does happen. The legal system is not perfect. Some people are not adequately trained to work with these types of population, but it is what it is. Fortunately for her, she was able to get the mental health community warrant, and her sister was able to get hospitalized. Unfortunately, if once you're stable in a psychiatric hospital, what happens next? You get discharged like any other person because you cannot live in a psychiatric hospital. And from there, what's important is also community follow-up, which is not my area of expertise. I'll leave that to Johnny.
Yeah. Okay.
But that's essentially the gist of what to do in a mental health crisis for your loved one.
Thank you, Kimberly. We'll get to questions later. I'm going to go ahead and go to Sarwa now. And Sarwa's going to talk to us a little bit about the mental health needs for recent immigrants and refugees and share her story as well.
A lot of stories. So coming from, the Middle East, and it's part of Asia, but what we're seeing here, people are coming from a war zone. And of course, most of them are traumatized. Me, I'm one of them. I didn't know about that until I got here. I was in like a circle of friends at the beginning, and there was a psychiatrist in the circle, and we were talking about the sounds and everything, and that's resonate with me that I'm traumatized from the sound of the car bomb, and when it's suddenly it's exploded, and we hear the voice. So what happened to me here, that I cannot hear the thunder. The thunder, it's triggered that sound for like 2 seconds, that I just said, what's this? Is that a bomb card? So and then I was talking to a bunch of friends, Iraqis, and they looked at me and they said, we have the same. So we didn't know what traumatize is until we start hearing about that terminology and what it means. So the people here, they don't know about their issues until they hear about it, or they hear somebody talking about it. The community here, the refugees really came from these communities where it's just like the Asian community. It's the hush hush, it's no. There's nothing wrong with you. You don't have to just go to the mosque, just pray, just eat, well, just have some sleep, go with a friend, you will be fine. I mean, they don't know what exactly going on. The education or the mindset of mental health, it's not exist there. Everything, it's if I say mental health, that means it's crazy. So that's why they ashamed to say that we have a problem. But when we start, like when I start meeting the people here, and after like, of course, I educate myself because of what I heard, and then I have the for a while I had that like um, depression because of all the transmission that it happened to me from that culture to this culture. Like I come here by myself with two boys. I have to work. I have to, it's all something new for me. And like there, I didn't have all of this responsibility, so I had that depression that also affect the community here. So I seek help, because I need to be on my foot and make a living. So um, that helped also in the like after that, how to educate the community. When I start working with Hope Clinic, it's helped more because like I have the access to all the resources here. Seriously,
Yes.
research in like sessions, workshops, read more. I hear people talk about it. I meet doctors. I talk to doctors. So it's also like raised my awareness about it. So I went to talk to the people as well. That make me more open to the community and talk to them. I'm seeing what I'm seeing here. It's the people now more welcome the idea of going to a psychiatrist or seeking the help. Maybe like you see a lot of them. They are not shame anymore.
Good.
Because they know there is something. They heard everything like in the workshops, and when they go to the gatherings, people will start talking about it
Good.
more because they know they have issues there. They come with the package here, so they need to address it, to acknowledge it. That what happened actually, and which is make me really happy, because I'm seeing that thing. It's make it and the resources as well. It wasn't there. People don't know where to go, but now they know. So with the experience that I saw, like a lot of issues people came from these environments. With the ISD, like I have some connection with this, especially with the kids, the teenagers. They turn to a violence students, and they called me several times because they know Hope Clinic had the behavioral health clinic here, and I saw one of them, beautiful young lady, beautiful, but she was slamming the doors, hitting the other students, like the other things with the parents and the family, and all that came from this shock that happened to her. Everything was like closed and conservative in her country. She came here with everything like allowed and open, and she want to engage, she want to be one of the group, but she cannot be left like aside. That's part of it. It's she cannot like blend in because her family is stopping her. That's one of it. A lot of the cases that I saw, we talked about the very educated lady, PhD in she was working with one of the hospitals. She used actually as a research, cancer research, and she has a lot of problems. She has depression, she has anxiety, she has personal problems, and she's taking the medicine, but nothing is like improving. And nobody in her family paying any attention to um, her problems. I talked to her several times, like trying to engage her with some group things, and she said, yeah, I will try. Um, but I need to go out, like I need to travel. But also, like again, nobody's hearing her. Um, Unfortunately, and like she committed suicide with taking all her pills. Like, and her son found her. And he called, like the friend and said, can you come? My mom died. But actually, no, she's been saved. She's been put under the supervision in the hospital for like 11 days, and then they released her. And then what? She's there. She's having the same problems now. I mean, she's still having the problems. She's still having, she created anything just to make people see her. She had the fight with her husband. She has the fight with her friends. But just to, say, I'm here. And I'm sure of that. But nobody's listening to her. And the husband is not putting that effort to put her in the rehab. Not because, for two reasons, because he's ashamed and he doesn't want her friends and the community to know. And then the second thing, that she's resisting that.
Right.
She's insisting that she doesn't have something serious. And I was expecting that to happen. And I'm expecting that to happen again. Because if she doesn't get the help as soon as possible, she will do it again.
That's right.
Especially she's living by her own, because the husband is separate. She doesn't want to deal with her anymore.
Right.
So that's the other thing of the stigma and the shame and the felt of like, I know I'm good, I'm fine.
Yeah.
That's part of it. But the others, which, look, this is something funny, because I'm seeing that the very educated people, the resistant ones, and the middle educated people, they adopt more, and they want to seek the help. The percentage of them, they want to do that.
Right.
Because I'm not sure why. I'm not specialist in this, but I'm seeing that, and on the ground.
Sure.
So I think, the raise of the awareness in the community, and educate them about, that we really need it. Not only the Asian, I'm talking about, the people from the Middle East. And Middle East, I'm talking about Iran, Afghan, Turk, and Iraq, Syria, and all this area. All of those comes from the war zones, need to rehab or evaluate at least. And we have a very big lack of that. I hope that one day the Arab community will do something regarding that, and do a beautiful summit like this.
Okay.
And raise the awareness. Seriously, we need it. And
Thank
right? Same page, right?
You agree totally.
Yeah. We need it because we need people to talk in their language.
Yes.
Yeah. And most of them,
Yeah. Yes.
Connect with resources. Yeah. So we need two things: the resources and the education.
Yeah.
Yeah.
Well, that's on our next steps list. We may need to do that. I'm going to go ahead and go on to Johnny. Thank you, Sarwa. Johnny's going to talk a little bit about navigating the healthcare system, mental health wise.
Hey, good morning, everyone. So yeah, like Dr. Gore introduced me. I have a background in marriage and family therapy, but honestly, my whole career has been more social work type. Yeah, so it was great to hear some of you guys and what you guys do, because like with the CHWs, I used to be part of like Unlimited 85 jail diversion program. So when I worked at Surge, we were partnered with Harris Center, formerly known as MHMRA, and Healthcare for the Homeless, and we would literally go in the jails and meet some of our patients there and then treat them out in the community. I've been part of the 1115 Medicaid waiver with people who just keep going into our hospitals and trying to get them housed. But before I get into all that, but I just want to say, like, I appreciate this small setting right now. Just letting you know a little bit about me. I get a little bit uncomfortable if I speak more than 5 minutes, so I don't like just like talking this whole time. So it'll be great if it's, sorry if I'm breaking any kind of procedure or protocol,
That's
but like,
okay.
yeah, I like a very dynamic, interactive type of presentation. So if you have any questions, please just ask. Because really this is just about like navigating our mental health resources, what's out there. And quick question, is anyone not from Houston here? Okay,
Oh yeah,
okay.
Christy's not.
Oh, okay, okay. So majority of you guys are from Houston. You kind of know what's going on.
Mhm.
Yeah. And so, we've already had our keynote speaker, Dr. Shaw, and some amazing people who are much smarter than me talk about like the basics of mental health and what to look out for, the signs. So I'm not going to go into that, but really just like my part is more just after the crisis has happened, my work has always just been the boots on the ground. Like, what do you do after that? Like after they've been hospitalized, they got out, what's next? It's not just like, oh, they're cured, they're out of the hospital. What can we do afterwards? Um, so of course, like all things are on spectrum with mental health. This is like a slide from NAMI. It just kind of gives you like the categories of like emergency mental health issues. It's already here, and then the crisis level. So Kim already kind of talked about the crisis level. You can find just like if you just Google NAMI Greater Houston.
And they have a booth here today too.
Oh yeah, yeah, great. Yeah, glad they're here. Yeah, they're very present everywhere. Um, and so when you kind of Google, so even if you're not from here, you can, it's really easy to kind of just like Google for mental health services. And so this is just like a snippet of what I do, what's available, and you guys might already know this. I think Dr. Shaw also kind of put this up here. And so really the two biggest ones, especially if you're underinsured or making around the poverty line, is just um, looking at Harris Center and Harris Health. And then with Harris Health, you have to look through getting the formerly known as the Gold Card application or the Harris Health Financial Assistance Program. But if you're not from Harris County, you can always just like look at the county, Google, Liberty County, Montgomery County, Fort Bend County, mental health services. And so the common ones are like, Galveston, Brazoria County, Gulf Coast Centers. Up north, we have Tri-County. And then if you're in Sugar Land, Fort Bend County, it's usually Texana. And so those are my go-tos for every time like people are like, oh no, I live in different counties. How do I get like mental health services there? But if you're insured, everyone's different. You can't believe how many people are just like, well, you have insurance. Have you ever called your insurance card? It's like, no, I have insurance, but I never called that. So a lot of times my work is just like, okay, give me your insurance card. Let's call this number together. And people are like, honestly, like sometimes in their 30s, 40s, like they've never called it. So it's like things you think are basic are not so basic for some people. So just like, hey, let's call this together. Let's get some referrals. I usually always like going through Psychology Today. A lot of people are going through online mental health services. That's something that can be hit or miss. And of course, PQHCs, just like all these different kind of clinics that we have in the Houston area.
I think it's FQHCs.
Yeah. Oh, FQHC. Sorry. I kind of didn't write that correctly. So yeah, I'm going just through common ones, like another one just through addictions. Usually before I even talk about addictions or what to go through, has anyone heard of the trans-theoretical model of change? It's kind of like
it's a public health.
Yeah. It's a thing where you kind of determine where people are. So just like mental health is on a spectrum, just because like you kind of push them towards something doesn't mean that they will necessarily go or they're even ready to go. So it's really just always determining where they are on the stage of change and how willing they're able to go. Because if you're saying like, hey, your blood alcohol level was like a 0.4, you need to go to rehab. Sometimes they're like, no, I'm fine. I'm just going to sit here. So it's really just determining where they are and like what's the first step that they can take. Then after that, then you can go through detox, NA, individual counselor group, sober living, that type of stuff. Grief, I always think the most premier place, I know there's people can tell me, just Bo's Place in Houston. And then, of course, I always go through kind of like the social work realm of like if they need kind of homeless services, if they need housing, they're just on the streets. Has anyone heard of the Beacon? Coordinated access, yeah. So Houston's actually one of like the premier places to seek homeless services. So before, like, I would say about 10 years ago, we were very siloed in the sense that like people would just go to like, oh, I probably need to go to Star of Hope, or let me go to Search, or let me go to Salvation Army. Let's see what they have. But Houston has really gotten together and made this collaborative. It's called Coalition for Homeless, and one of their main places is the Beacon. So like I always tell doctors, nurses about like, hey, if there's a homeless person in your ER, send them there if they need housing or if they've been on the streets for a long time. Because we're always, social workers always belief of like housing first. Because even if they have mental health issues, it doesn't matter if they're still on the streets, that problem is going to persist. So you got to get them housed first, and then you do wraparound services around that. And of course, Texas benefits, SNAP, TANF, your Texas benefits, employment, workforce solutions, Goodwill Houston Job Connections. Actually worked for Goodwill for like a year. And then you guys would know more than me about Houston Immigration, Baker Ripley, the Boat People, Catholic Charities, Chinese Community Center, all that stuff. And I'm sure I'm leaving out a lot of other social work stuff that people are that go through. But then yeah, that's basically it. But yeah, so that's why I feel like this should be more like a dynamic. If you have questions about like what is it that how can I deal with this certain person, or we can probably talk about that together. Yeah. Yeah. Yes. Yes. Yeah. So with a lot of these hospitals, so yeah, I've had the privilege of going through like at least I want to say like 7 or 8 of them in the greater Houston area. And usually they offer some kind of IOP, like intensive outpatient or partial hospitalization program. But yeah, unless they're under court mandate, almost everything I have is almost voluntary, especially with addictions. Because you can't just like force someone to go to a sober treatment center and like they have to stay there. They can really just like get out if they really want to. But then after that, if you have to go through IOP, PHP, then it kind of goes to just like individual counseling, AA groups, or whatever supports that you want to go through. Uh-huh. Yeah.
It's a good question. Yeah.
Yeah. Dual diagnosis. Yep. Yeah. It's almost like a symbiotic relationship. Yeah. Because like sometimes, people with mental health issues, they self-medicate. Yeah. Instead of going through the proper channels of a psychiatrist to deal with like their anxiety or depressions, like, I'd rather just drink a 40 ounce this morning to feel a little bit better, or just to really, honestly, it's just really just to numb things. Yeah. Rather than like kind of process it. So yeah, it is kind of like a chicken or egg thing. It is kind of go both ways. Yeah. And then like, yeah, if you're drinking every day, you're just gonna get even more depressed once like it kind of wears off. Yes, absolutely. Yep. Things have changed. Yeah, chemically in the brain. Yep. And they need more of it. Yeah. Yeah.
In regards to that, it often goes hand in hand, mental health issues as well as substance abuse. So I used to work at a rehab, and what we say is, well, they got to get sober first before they can start working on their mental health issues, because how are you supposed to work on your past traumas if you are still smoking crack? It's going to be very hard for you to do that. And that's why I would say, like, let's go to rehab first, have some sort of period of sobriety. But what's important is to continue to have the ongoing support of like a therapist or like an AA or NA group while you're working on the mental health part.
Ping, you had a question?
We can use the community now. Because based on, thank you. First of all, thank you for the 3 speakers presentation. Yeah, I really enjoyed all your talk. And based on what you have, I heard when Asian American, like the people have the mental health issue, the first help definitely it's all right now we really rely on the family members. So it always just family member identify the issue and send them to the hospital, or like even just receiving the process. But in addition to I know it's our culture because family is so important for us. But in addition to the family's help, what kind of the community, even any community-based like a community resources or community programs, like it really can help our AAPI community recover or identify problem, or just like what kind of community, what community have you?
Yeah, so let me touch up on that. So before I agreed to this with Dr. Gore, I was like, full disclosure, I am no expert on AAPI stuff, even though I'm Asian myself and I took a few Asian American classes in college. I am no way like qualified to talk about AAPI and what's going on there. I haven't done looked at the research or anything like that. But I can tell you about with community resources. I always talk to my clients about like mental health is both a science and an art, right? Like, yeah, we have the meds, we have therapy, that's evidence-based practice. But then is that it? Is like, does that cure your mental health? No, obviously not. Yeah, there's this whole art side of it where it's like you got to find your own way of like doing things, whether it's be like yoga or like self-help workbooks or being part of a community group. And, you know, like I had a client that did essential oils, like that really helped. So it really is art. You got to figure out yourself. But for sure, I don't know if there's anything like really established within the community, but I always found like churches to be really helpful.
Yeah, churches can be
yeah,
helpful.
absolutely.
Yeah.
Like I'm part of a so like I said, when Dr. Gore talked about me still being working with a formerly homeless, I run a group that's like combined with like the what is it, the St. Paul's United Methodist, where we like the church, search, and like other people in the community kind of volunteer to kind of get together to just like have dinner together and talk. But then afterwards, we have like this group, like therapeutic group. So really, it just depends on the community and like what churches are willing to do, get involved. Because yeah, I think yeah, full disclosure too. I'm part of like a church myself. And I think church members always finding like, oh, how can we best serve our community? How best can we serve God? And I always find it's like, you know, it's more than just serving in soup kitchens or doing anything, but you really got to be embedded in people's lives. And yeah, it's hard to find people like that who's willing to do that. Yeah, take time out of the day to be part of that. Yeah.
Albert, yeah.
Question, Kimberly, you talked about crisis at a point, but a lot of the problem with mental health is people have already been in the system, they've gotten counseling, maybe they've been institutionalized, and then they come out, and then they're on their meds, and then yeah, they go off. And you mentioned some of the problems, you know, dealing with the legal landscape, you know, those issues. Do you see getting any better dealing with people like that, or what's the landscape look like? About, you know, because you're going to deal with mental health for a long time, and you know, always on the news, there's some story of somebody hurt someone and they have a history of mental health. Is that getting better, or what's the, kind of the solutions to that? Not just from the crisis side, but we know people that have been in the system and have trouble and not getting any better, or they're on their meds and you feel better. Oh, I stopped taking my meds.
So I can't talk in regards to like if it is or will not get better. But what I can say is what you just stated is very common, that it's like it's like people go in and out of the door of jail or hospitals because they do think that. It's like, oh, I'm better now. But it's really dependent on the person and very dependent on their support system. So like if the individual has really good insight to understand that, you know, I need to stay on these meds to stay well, then they're more likely to do that. If they have, you know, people to live for, and like they have goals and they like want to improve and they see like a really bright positive future for themselves, then those are the people who are more likely to, you know, follow the routine of like, okay, I got to go to counseling, I got to stay on my meds. But the people who don't have that support, or like especially the people who don't have housing and they have like nothing really to live for, they don't really care. They're like, I'm just gonna go in. I have to take my meds because I have to be here. And once they leave, you know what? I really like doing XYZ. I'm gonna keep smoking weed or using PCP, and it's like a revolving door of jail and hospitalizations. It's extremely common. And that's why it's very dependent on the individual themselves and their support system if they have it. Because if they don't have it, they're usually the ones that are going through the revolving door.
You have a comment?
In order to get a mental health warrant on someone, say I have a daughter that's an adult, does not live with me, but I see erratic behaviors and things now. She knows that something is wrong, but she doesn't think, you know, like what I can see, she can't see that. Am I able
to apply for a mental health warrant? Yes. She doesn't have to, they don't have to live with you. If you see it and you can write enough evidence like on the application to get to submit it to the judge, it'd be up to the judge to be like, okay, this person needs help. So you can like look it up. So like if you're in Harris County, use the like Harris County mental health warrant, and you just like Google that, and then they'll like lead you to a page that will probably have like information as to how to apply for a mental health warrant. or I think you can probably just go to, also I think you can go to the Harris County Probate Court and also ask for an application. Because I think that's also where you submit it too. Like you'd submit it to the probate court there, which is housed within the Harris County Psychiatric Center in Houston, because their probate court's like within the facility.
How long does that take though? Because I've been someone's in a crisis situation. I got to fill out this form. Half a day. That's pretty good. Okay. But you said the judge has to sign off on it, right?
Well, yeah, if it's a mental health community warrant, yeah.
Okay.
Like the ones that you actually apply for.
Okay. Okay.
So I was just gonna kind of piggyback on what you were saying, Regina, along with what he said about, do you see it getting better? I think that it only gets better if we all do something. A lot of times we'll see something going on, but we won't say anything. If we all say something, then things will get better. Just like Regina was saying about maybe you know someone who's going through a mental health crisis. No, they don't live with you, but if you know they end up harming somebody or themselves, if we say something, then we can prevent a crisis happening. So if we see something, say something.
Yeah.
Oh,
you see people, they take a homeless person, there's no family member to like say, oh, I know this person. Wait, you see, we've had, in my neighborhood, we've had at the intersection of Braeswood and Hillcrest. This is the second person that's basically living at the Metro bus station. And everyone in the community offers help. They give them things. This was last week. Somebody was at a different Metro bus stop, and they died because of the freedom.
Yep. Yeah. So even though Kim and I work for Momo Herman, I think we told our bosses we'll be doing this. We do not represent the views of Momo Herman. So what I'm about to say is really just reflective of me. And it's not to sound like a jaded social worker, but I always see all my clients throughout the years as like on a bell curve, right? There's like 15%, 50% that are the outliers. So top 50% are the ones like everything you do, they're great. They're going to appointments, they're meeting up with their families, they're getting sober. And then, people in the middle are just like, oh, that kind of works, doesn't work. But then I consider that the bottom 15, 20%, I consider them my forces of nature. It doesn't matter what you do. You're a kite in a hurricane. Like you can have the best treatment, the best family trying to look out for them. The whole community is coming out to get them. I don't want to do any of this. I just want to sit here and be drunk and you go in and out of the hospitals. It doesn't matter. So that hopefully it doesn't sound like too pessimistic, but sometimes I feel like that's just how it is. Yeah, it doesn't matter what you do. You can be the best miracle worker. Yeah, you won't change them. So with Momo Herman, we just say anywhere from 3 to 9 months. Hope we can extend it past 12 months if need be. Referral only. Yeah, it's not open to the public, unfortunately. Yeah, people always ask, it's like, hey, how can we get a case manager? No, it's just through the hospital. They end up in our ERs, med floors, and a clinician evaluates them. Then it'd be like, I think you might be good for a case management that gets referred to us. So it's all internal. And unfortunately, it's not out for the public. Yeah.
Really?
Yeah, but a lot of other agencies, they have case managers, hit or miss case managers. Harris Center has case managers. Yeah, a lot of places.
Yeah.
I was gonna say, a lot of the other counties have case managers like Texana and the Harris Center. But those with insurance, they also have case managers with their insurance that people don't know about, that you can actually reach out to your health insurance and because you can get referrals from them, but you can also get case managers because let's be real, insurance companies don't want to pay for your stuff. So they'd rather you stay connected and keep you connected so you don't have to go to hospitals. They would rather pay and help you get connected with outpatient referrals than for them to pay for your hospital stays.
They're Medicaid care coordinators. They have Medicaid, yeah. They're going into hospitals, yeah. They should have a care coordinator. The red flag should go up with Medicaid.
Yeah. Starwood, do we have that here at Hope? Any case management like that?
I think yes, we do.
Yeah,
we
that's what I
have
say.
the referrals, and we
Uh-huh.
have, like, the whole staff, like, all the care coordinators, they work
Mhm.
on that. So
Yeah.
any issues with the patient,
Mhm.
raised by their PCP or the OB, the whatever, like, specialist, they would send them to the care coordinators, and they will take it from there to send them
I
to.
figured we do have that services here too. Yeah.
Yeah, and
Case
we have
management.
the clinic as well,
Mhm.
so
Right.
it's either or. So
Yeah.
if we don't have the service covered by Hope Clinic,
Uh,
we refer them
refer them out.
outside.
Good.
Yeah.
Good. That's another resource. Any other questions? Regina, did you have your hand up?
That I think, like, put together, like Johnny was speaking on, like these summits and raising the awareness, and there's more awareness than there has been. Social
Yes.
media is good for a lot of things,
Uh-huh.
and people coming together and creating environments such as this, a community such as this, and setting them up, and volunteers coming in to, service, because like I used to work for the healthcare for the homeless many years ago, and every year we would do a roundup. We'll go try to reach the homeless, and we had different organizations that came on, like the treatment center, everybody that would house them and provide service for them to get off the street and become better. Well, maybe 10% of the people wanted that, and the others
Right.
wanted help. And that's part of their mental health.
That's right. Mm-hmm.
But I also have a family member that was also a doctor. She had a great and her pride and ego and the things that she thinks she didn't accomplish, she had accomplished. Help her. She was dealing with that for over 10 years. She ended up back at home and everything, and she couldn't accept that about herself. But she had great support, And I say the last year she has come back around, and she's teaching and everything. She was in college teaching anatomy.
Anatomy.
She was doing a lot of things.
Yeah.
And so now she's a school teacher, and she's great with the youth and everything. But her you was talking about the intelligence. She had so much smarts that it harmed her. If she was too smart for her own good. So the therapy and everything, she didn't think she wasn't comfortable going to therapy.
Yeah.
Because of, her image and
yes.
what they think about her and all these other things. But like I said, she had great support. We have family members in the field and everything, and no one gave up on her. And and she would call 911 on somebody because she's hearing voices, and it took us a while even though that she was hearing voices.
Wow.
She covered it up so well. But today I saw her last year when she started coming around, smiling and interacting and everything, and my heart just felt good. So there is hope, and it's really good to have support. So we as a community, if we can come together and create different communities and organizations in certain locations and everything, they fund everything else.
Right.
And then having to create a space for people to come in and provide those services. And they may come in and out, but at least they know it's there, and somebody's going to be reached. But then, like he said, it's just just not.
That's good. Thank you.
In regards to what you said, yeah, I think it is probably more challenging for people with higher intelligence to get help because, I think I know everything. Part of that is just really needing to just humble yourself, be like, I don't know everything. I need help. And then to get help, it's kind of like how they say like doctors are their worst like patients. It's like as a therapist myself, like if I needed help, at least I'm smart enough to know I need help, and someone can provide me other insights that I may or may not already know. Granted, I was kind of double dipping because when I saw a therapist, I was like, oh, I really like these tools. I'm gonna use these tools too in my counseling sessions. But I think that's just really important, just to humble yourself and realize like you don't know everything.
Yes.
It is okay to get help. Why? Because I value my life, and if I'm struggling, I want to do whatever I can to get better, because who really likes to struggle? And no one.
Nope.
I think she answered my question, like earlier when I said the educated people didn't go.
Right. Okay. If y'all don't have any questions, I'm going to ask a few that I prepared. How do you begin the talk about mental health in an Asian household? Johnny. Well, not any of y'all, but I think you had actually suggested that because one of the things that, okay, when I had my discussion with them before, I said, talk about some of the things that we see on the headlines, about these murder suicides and, honor killings. And they said, well, that's really not those are not as common. Those are more media driven. So I said, well, they said they want to talk more about what you see in an Asian American household and how you address those. So that was one of the things. How do you begin talking about normalizing mental health in an Asian household?
Has anyone seen that movie, The Farewell?
It's coming on. I saw that.
Yeah. It's called The Farewell. It's about a Asian American who had to go back to. I hope I'm not spoiling. Spoiler alert.
It's okay.
I think the grandma had like a terminal illness, but yeah, cancer, and so a lot of the family members like rather not tell the grandma and just act like everything's okay so that she can just live a wonderful life. But like the Asian American person was like, no, we have to tell grandma. Why is everyone acting this way? Everyone's crazy. We got to tell her. And so I feel like mental health is kind of like that way. It's like people see it, people know it, but they don't really necessarily want to acknowledge it.
That's right.
So because in private practice, family enrichment clinic, I sometimes like would see families bring in their like daughters or children as like, this person has issues. You got to solve them, deal with them. And what's funny is like with the Asian community, it's usually like, with first off, like what Dr. Shaw says, like it's language, right? But then the second thing, like usually Asian Americans don't come in is because of the finances. So usually when Asian Americans come in, they usually want to get their money's worth. So they don't want you just listening. They usually want to like give me some like advice. I need something here. You can't just like listen and like, okay, the hour session's done. And so with my family, it's just like kind of like, okay, so let's break it down. Let's just begin with basic mental like health, depression, like going through like an inventory. And so, but what's funny is like, yeah, like the parents are like, oh no, I don't think I want to take that because they're kind of scared for themselves. Like I might have depression or I might go through things. So they always like kind of like push it off or project on their own children what's going on. So really it's just kind of breaking down like what is mental health, breaking down the symptoms of it, but then just having a conversation of like the language that people use because like it's not just with Asian like I said, I'm not an expert on Asian American issues, but I see a lot in different communities, the Black community, Hispanic community, that like they use the word crazy a lot. So what does that crazy even mean? Or like, oh, that's just how that person is, and I've always lived that way. Well, what is that is, and like, can we break down like the symptoms of that? But really, just like basic psychoeducation on what mental health is and what are the symptoms.
I'm going to piggyback on that because I think another reason why API families are concerned is because as a parent, you also don't want to think that I did something wrong, especially on how you raise them because, the older generation of Asian people, like, what are feelings? How many times have I heard people say, just suck it up, get over it. It's like, oh, feelings are a thing. So I think it's hard to like educate like older Asians that, feelings exist. Your child has feelings. And some of the things you do lead them to feel this way. So the other part is whether or not they're willing to accept responsibility that I may be doing something to contribute to my loved one's mental health. Because again, mental health isn't a thing, just like feelings. So it's a lot of education and willingness to actually learn and understand this culture of like, okay, wait, so they need to do what? And then also, I think the concept of people thinking like, once you go to counseling, like, oh, they should be okay now. Like one session, it's like, oh, you had years of trauma. One session is not gonna do it, but okay. So, and then because I don't see children in my private practice. I only see adults mostly because I don't want to deal with parents. So that's just my personal like choice. But I make an exception to like this one like child because the mom was like, I need someone to talk to my kid to figure out what's wrong. So I talked to her and she was like, she won't go around her dad. Like, did something happen? And then I only had like one session with her and she went to me because I'm an Asian therapist. And then after session, I was like, well, she didn't mention any abuse, but she doesn't like it when you guys yell at her. because as a young child, if you're being yelled at by your parents, you're gonna withdraw. It's a very common thing. You may feel sad and not want to like talk to them. And I was like, I should lay down on the yelling at her. She's only 11. And she's like, oh, okay. Because she was really concerned that like if the dad was abusing her. I was like, I'd ask all those questions. She didn't say anything. She actually didn't really she didn't really look sad. She was just kind of like withdrawn. But that was like the only time I saw her, because otherwise like the kid was like doing fine in school and there was like no bullying or anything like that. But it's just kind of hard to just, accept that you may be doing something wrong. But yeah, just to be able to listen to your loved ones as to like what may be going on. Because I think that's the other thing too. Because with our community, the pressures that parents give to their children.
Yes.
I had a client who was in med school who was extremely depressed and often had suicidal thoughts. And she was very, very intelligent. She had multiple therapists. She was on meds. But the pressure her parents gave her about her being a doctor was very overwhelming. And she went through med school, but she was not planning on doing residency. And she was like, how am I supposed to break down to my parents that I'm not going to be like the doctor that they want me to be? And I was like, well, there's going to be a lot of education. You got to tell them like, look, I don't want to see patients. She was trying to go the consultant route. For those who don't know that, physicians who like go to med school, they can actually be like healthcare consultants if they like end up not going to residency. And that's like what she wanted to do. And I was like, well, at some point, you're going to have to tell them, because they're going to be wondering why you're not a doctor. And that was the really scary part for her. But she did whatever she could to try to like prepare for her future. That way she didn't like disappoint them as much, because she would technically still be a doctor when she graduated medical school if she passed her boards. But this is the rest. It's different.
Wasn't going to be a clinical doctor
Right.
like that. Yeah. Okay. Okay. So one of the other things that we talked about was, well, actually, Dr. Shah, he said that there's a lack of culturally and linguistically competent mental health professionals in our area. And one of the things that I've learned from putting together this seminar is we have actually quite a few, it's been great to find out that we do. I mean, when I found Kimberly and Johnny and Sarwa, someone, behavioral health too, this is wonderful. We almost need to make a directory of all of these people.
There is a directory online.
Yeah, there is a directory. I know, but see, people don't even know that, there's a directory. So that's one thing. Okay.
Can I piggyback on that real quick?
Sure.
Because of the whole AAPI campaign,
Sure.
there have been multiple organizations that have created online mental health API directories but the clinician has to like sign up, put their name information on there.
Right.
But I think one of the best things that came out of COVID is the fact that telehealth is way more popular than before. So if you're not able to find like a Mandarin speaking therapist here, you can see anyone in Texas who's licensed. And that's exactly what I do for people who are looking for like Vietnamese speaking, because I don't speak Vietnamese, therapist.
Are you Vietnamese?
I'm Vietnamese, but I don't speak Vietnamese. I'll understand some. I know how to order food. But
I can do dim sum.
But yeah, so I would refer people to I think Psychology Today is actually a really great resource, because you can filter like a certain language speaking therapist, and if they accept your insurance, you just have to call them and ask, which is actually what I did like 2 weeks ago, when one of my clients who like moved out of state reached out to me asking if I could help find a Mandarin speaking therapist for his mom. And I was like, okay, Psychology Today, Google filter. These are everyone that's licensed in Texas that speaks Mandarin that probably accepts your mom's insurance. Here's the referrals. I hope she reaches out and finds someone, which is great. So that's like underutilized resource that people don't know, that you can just see someone online. I think in person's like the feelings feel better to see them in person, but accept help where you can, whether it's in person or telehealth.
Yeah, better than nothing. Yeah.
I think for our communities, worse, because like we don't have that much resources. For the Arabic community, they are kind of new in the city.
Yes.
we became like big number now, like
Yes.
a few years ago,
Mhm.
but not like the Vietnamese and
And
the
Chinese.
Chinese.
You're right.
So that's why like we don't have a lot of Arab, like resources here. For the people who doesn't speak English, they really want to see a Arabic speaker
Yes.
doctors. Sometimes like even me, like I would really prefer to see a psychiatrist or therapist like speak my language.
Sure.
I can't speak English, but like at some point I feel like I'm stuck, like I cannot give the full description of what I feel. And also, like because that person probably know my culture more.
Yes.
When I talk about like my trauma or the incident that happened,
sure,
he feel related to it because it's either he saw or lived or like he's been there for even a while.
Oh yeah.
Not like the American, if I will go to an American, no offense, but if I will go to an American doctor.
Yes.
And I'm talking about like the helicopters, the bombs, the cars, the dead people in like bodies in the street and whatever. How can he become like related to me? He will say yes. I'm sure that he will nod his head, but it's not like somebody lived the same, so he can feel what I feel. It's the hurt or the what's in my mind, what I see in my like for years the dreams that like chasing me. It wasn't easy like at the beginning. So that's the lack that I'm talking about, the language and the resources. So the resources is not that we don't have it in Houston, but we don't have the people who can understand and speak the language.
Good point. Very good point.
Because that's the second thing, like even the new graduate, they still like, but not the experience, right?
They don't shit
So
it.
we're waiting for the second generation to get.
Yes. Yeah.
We have some doctors actually. I checked, but it's either they don't like see new patients. I have one of my friends. I asked her the other day. She said, "Well, I don't see new patients because she's moving from an institute to another, or they don't they don't receive my insurance. They I cannot use my insurance with that. I cannot use Hope Clinic as well because like I'm not allowed to. So yeah, that's one of the things because HIPAA and all that kind of stuff. But that's what I'm talking about. And like there is a lot of lack of things in the community. So now we have the list. I think we should work on it.
Yeah, that's another next step for this. That's very good. 2 minutes. Okay. I'm very time conscious. Let's see. Okay. Another quick question. Do you think AAPIs have a high rate of substance abuse?
For the Arab, I think now they do. With the new generation, yes. The tobacco is not
Tobacco.
It's about, yeah, but like with the drugs and the marijuana, I think like it starts getting higher.
I have a specific question about smoking marijuana.
Okay, go ahead.
So there is a debate because the people who smoke marijuana, they say, well, it is now legal everywhere. So it's nothing.
And you cannot get addicted to it.
Right.
But I mean, there is a borderline where it is a dependency or it is not a dependency.
Right.
And they all say, well, I'm in control. I know how much.
Yeah. Right.
So how can we draw this line?
Yeah. It's gonna kind of go hand in hand with that. It's just about like substances in general. One, they have to think it's a problem for it to be like Oh, I have a problem with substance abuse. I think with Asians, probably the highest would be alcohol abuse, but if they see it's a problem. But what to look out for is one, how much are they using? And like how frequently, what are they using it for? And how does it affect your everyday life in regards to your family relationships, your work, school, legal? Like, for example, it is not normal to have 3 DWIs. You probably have a problem if you have 3 DWIs. If you have to wake up and drink alcohol, okay, that's not normal either. You probably have a problem. How often you use, right? I know oftentimes, like, yes, culturally, like smoking hookah or like people who like smoke cigarettes. But how much money are you spending? How is it affecting your health? I think all those factors, if you like assess them, can determine like if you have a problem. If you have withdrawal symptoms, that's a problem because that means you use enough to where you're having symptoms if you're not using. You're shaking your head because I know you work with Sam today. You're like, yeah, these are all problems.
We're going to have to wrap it up. But I want to give a round of applause to all of our panelists. I think we could go on for hours, but I really feel like I've discovered some treasures in the community by finding these people who can talk about mental health in our community. So I want to thank you for being here, and we're going to go ahead and go into a break and then get ready for the next breakout session.